So, starting with the lecture number 16, Bismillahirrahmanirrahim, continuing with the topic of drowning, and as I am discussing the autopsy findings, so I will be continuing that. And the learning objective of this video lecture will be that I will be discussing more internal autopsy findings, which are the most important, the role of diatoms in drowning. Then what is diatom test? And then other signs which are of special concern in drowning. And I will also discuss in this lecture the medico-legal aspects of drowning. That means whether the death is due to drowning, and if it is due to drowning, then is it suicidal, homicidal, or accidental. Then we will also learn in this lecture determination of time since death in drowning. Then I will discuss various difficulties which are faced in diagnosing death due to drowning. Now, starting with the role of diatoms in drowning. As we know, these are microscopic unicellular algae suspended in water, and most of the natural waters contains diatoms. And they have a silicon cell wall which resists acid digestion, heat, and putrefaction. And their average size is from 10 micron to 80 micron. They live free, or they can unite to form colonies, either in plankton form or they can attach with somebody, with something. This is a diagrammatic representation showing the various types of freshwater diatoms and marine diatoms, because they are different and their presence within the body will tell us the medium from where the body is recovered. These are various shapes and types of diatoms: single presence, multiple presence, and plankton forms. This is another picture showing the diatoms. This is another picture. So these are many hundreds and thousands and millions of type. In each water they are of different type and shape. Only the living person with the patent circulation can transport diatoms from the lungs to the tissues, and where they can be detected microscopically at autopsy. And their presence within the viscera only is of no significance, because we have to confirm with the medium from where it is recovered. Because all the waters contain diatoms, and to ascertain drowning as the cause of death, a particular medium from where the body is recovered, we have to match the detected diatoms with the control. That is, we detect the diatoms within the body, and the pattern is studied in presence of various patterns, and then that pattern is compared with the control, that is the medium in which the body was drowned. Then it is diagnostic and confirmatory if the pattern is same. This is the diagram representing the diatoms entering into the lungs, then with the circulation going to the heart and other tissues of the body. What is diatom test? Diatom has yet again proved to be only of golden standard in death due to drowning cases, because diatoms has a silicon wall and are unicellular microorganisms, and a sample of material may conveniently be obtained from the femoral or sternal bone marrow. A small portion of bone marrow is scooped out into a test tube. Strong nitric acid is added and it is heated till the clear fluid is obtained. It is then cooled and the sediment is examined under the microscope. The freshwater and seawater diatoms are different. So the diatom test is valid if the deceased did not drink this water immediately before submersion, and the species recovered from the specimen are present in the species from the site, that is the sample in which the person was drowned, and the species are in the same order of predominance. These are the significance of diatom test, then they are helpful. So if the species of the diatoms found in the body match with the species of the diatoms from the water where the body was found, it is strongly positive evidence of drowning. Now, other signs. The temporal bones should be examined, as a significant number of drowning victims show hemorrhage in the temporal bones. In order to establish drowning as a sole cause of death, it is essential to rule out any disease process that may contribute to death. Any fatal trauma to the head or neck may cause death without any visible injury. And the toxicological analysis should be done for the estimation of alcohol, sedatives, and epileptic drugs. Now, regarding the medico-legal aspects in a case of drowning, which is that whether the death was due to drowning or not. And if the death was due to drowning, then it was suicidal, homicidal, or accidental. And the objective, the time since death, we have to determine. Now, regarding the death was due to drowning, it is common to kill a person or poison and throw the body in water to conceal the crime. In a typical drowning, there will be fine froth at nose and mouth, the material grasped in hands, the froth in the respiratory passages, and the edematous lungs, and detection of diatoms in the body of similar pattern of the medium from where it is recovered. So these signs are seen in fresh bodies. If the putrefaction sets in, then the diagnosis will be difficult. So regarding suicidal, homicidal or accidental, the appearance of the drowned body will be the same, whether the disease jumped in, fell in, or was thrown into the water. The circumstantial evidence will decide the case. Regarding suicidal act, suicidal is fairly common amongst females, especially in towns which are situated near the water reservoirs like sea, rivers, and canals. And women usually make sure to tie up their clothes in such a manner that their private parts are not exposed even after their death. A determined suicider may even tie himself or tie weights with the body before submersion, or may take some poison or cut his throat and then jump into the water. However, in such cases, the body is free from other kind of injuries indicating an assault. So regarding homicidal in nature of drowning, homicidal drowning is rare except in infants and children. An adult may be stupefied or overpowered and then thrown into the water. Other injuries may also be found in homicidal cases. Then regarding accidental drowning is quite common and it is seen in children, bathers, swimmers like the swimmers, fishermen, dock workers, intoxicated and in epileptic persons. Injuries may also be sustained during the accidental fall. Now regarding the time since death from drowning, how we can calculate. Unfortunately, the time since death in bodies recovered from the water cannot be fixed. The longer the time between the death and the examination, the greater the latitude be allowed. And a close examination can avoid inaccuracies. A watch may stop, this is circumstantial evidence, a watch may stop which gives an indication of the time, somehow the date also, when the watch stopped. The temperature of the water falls rapidly. As per Casper dictum, rate of cooling in is twice in water as compared to air. Similarly, other findings like putrefaction. The rigor mortis sets in early as there is rigorous usage of the muscles in an attempt to save himself. So the glycogen contents of the muscles are utilized. Then the wrinkling of skin starts appearing shortly after immersion, and bleaching of cuticle is in 12 hours and sodden appearance in 18 hours. Then floating of the body due to accumulation of putrefacious gases, it occurs in about 24 hours in summers and 2 to 3 days in winters. Fleas are drowned in about 24 to 27 hours. If any of these insects are found on the body, they should be placed under the watch glass and observed. Majority of the lice die within 12 hours, but a few may live for more than 48 hours underwater. Putrefaction first begins in the upper part of the body. It slowed down as long as it is slowed down as long as the body is in water. But once the body is brought out, it sets in rapidly. The skin of hand and feet become loose and peeled off like gloves in about 2 to 4 days. Adipocere formation may take place and it will take about 5 to 15 days. Now, the difficulties regarding the diagnosis of death due to drowning. The difficulties are when the signs of drowning are absent, when the injuries are found on the body, and when the body is in the decomposed condition. Now, regarding the absence of signs, the signs of drowning are absent in the bodies that are recovered from water when the person had died of laryngeal spasm, or the person was killed and thrown in water, or if the body was decomposed. So minimal signs are found in the submersion of an unconscious also. Then other injuries. When the injuries are found on the body recovered from the water, it naturally will arise a suspicion, and they may be suicidal cuts, homicidal injuries, injuries sustained during the accidental fall. It should be remembered that the injuries sustained before or after and during drowning, although are antemortem in nature, but they do not show ecchymosis because there is continuously being washed by the surrounding water. That the bleeding, if it is occurring, it will not be organized, it will not stain the tissues at the site of injury if the wound is open, and because water is continuously washing it away. A microscopic examination is therefore necessary. So injuries which are sustained after drowning, that means postmortem injuries, they can appear. The most common injuries sustained after drowning are those caused by fishes, frogs, crabs, and other animals, or even by passing boats. They can hurt. But these injuries, they will be post-mortem in nature. They will not be showing any ante-mortem vital signs. The animals attack the protruding or the projecting parts of the body like eyelids, nose, ear lobules, fingers, and scrotum. The distribution of injuries, their postmortem nature, and the nibbled margins help in diagnosing these injuries that they are postmortem. Now, regarding decomposition. In decomposed bodies, when the putrefaction sets in, the signs of drowning are masked and they may be entirely obliterated, or we cannot find them, distinct them. The fine froth is replaced by blood-stained putrefactive fluid. The lungs undergo softening and blood stained because accumulation of pleural being in pleural cavities. Then stomach is usually empty and the contents transudate out or are forced out. However, in early stage of putrefaction, diagnosis of drowning is possible in some cases. Fine froth may not be present in nostrils, but it may be found in trachea. Aquatic material may be seen there. However, in advanced stage of putrefaction, the drowning cannot be diagnosed only on the presence of aquatic material in the upper respiratory tract can help in diagnosis. In such cases, the viscera should be sent for chemical analysis. As diatoms resist putrefaction, their presence, especially in brain, bone marrow, provide a valuable evidence of death because of drowning. The chemical examiner should examine the viscera which provide evidence regarding poisoning. And in case of negative chemical examiner, negative diatom test, the cause of death cannot be given. That is, the drowning as a cause of death cannot be given. So summary of this lecture is that we have understood what are the internal autopsy findings in drowning, and we have learned the most important aspects as the role of diatoms in drowning, what is diatom test, what are other signs which are of special concern, and we have discussed the medico-legal aspect of drowning, and that means we have understood that we can determine that whether the death was due to drowning, and if it is due to drowning, we can try to find suicide, homicidal, accidental in nature. Then we have learned the postmortem interval, that is time since death in drowning. And we have also learned the difficulties which are faced in the diagnosis of drowning. Thank you very much. So this is all about the drowning and asphyxial death. So this was the last lecture of the asphyxial deaths. So take care. Allah Hafiz. And now I will be starting the discussion on the next topic of forensic medicine, inshallah. Take care. Allah Hafiz.